Okay, so group 2 for MOIS 2 will be presenting Health Heaven Clinic, a doctor's clinic appointment and follow-up system. This is the table of contents. First, we're talking about description, case diagrams, database tables, queries, and user interaction. Database description. The purpose of this database system is to manage follow-up and appointments for the clinic in an efficient and straightforward manner. It also ensures smooth experience by providing the patients and clinic workers easy-to-use interface. The user access have patients and doctors, where patients can make appointments and view available doctors, and doctors can update records, see schedules, and review patient medical histories. Then the case diagram. Okay, so we have two actors, the doctor and the patient. The patient can check for available doctors, cancel an appointment, book an appointment, and request prescribed medication. And when the patient book an appointment, he can also attend a consultation after that. And the doctor can update their schedule, check for appointments booked, request medical test from the patient, and request a prescribed medication. And based on the prescribed medication, the doctor can update the patient medical record.
Next, we have database tables, where we implemented them in Microsoft Access. Starting off with the doctor table, where the table provides information about the doctors, such as the doctor ID, their name, and each specialty, and their contact details. Then the patient table, where it includes details about the patient, including the patient name, date of birth, and also contact information, as well as a checkbox for if they are insured or not. Next is the doctor working timetable, where each doctor with their ID has a specific working day and a number of hours. All three attributes act as a composite primary key. Then the appointment table, where the table provides information regarding each appointment, including the doctor ID and patient ID as foreign keys, and the date and status, whether each patient showed up or not to the appointment. After the appointment, there is the consultation table, where this is a result of a patient attending an appointment that has been booked beforehand. Also, there is a medical note attribute, where all the previous medications and prescriptions were given by the doctor. And this will be used in a following slide for the queries. Lastly, we have the follow-up table. This table includes information about any follow-up appointment that the patient books, using as well the doctor ID and patient ID, and whether, of course, they have to be confirmed.
So as for the relationships that connect all these tables together, the consultation is connected with the doctor and the patient because it's attended by both of them. For the doctor working times, it's connected with doctor only since they are related to the doctor. As for the follow-up, it's related to the doctor and the patient since the patient books the follow-up and the doctor attends this follow-up as well. We also have the appointment date as a foreign key here because the follow-up is completely dependent on the existence of a previous appointment, because you cannot book a follow-up without actually booking an appointment beforehand. And the follow-up can access the appointment through doctor or through patient. And as for the last table, which is appointment, the appointment is connected by patient and doctor since the patient books the appointment and the doctor checks this appointment in his or her schedule. And we made the doctor ID, patient ID, and appointment date as primary key, as a composite primary key, because we had this assumption that a patient can only book one appointment per day with a doctor.
So for the queries, we've implemented a few queries to gather specific information from the database. The first query is shows the appointment with the doctor name and the patient name as well as the appointment dates. The second query shows the consultations with the doctor name, the patient name, as well as the appointment dates. The query below shows the follow-up with the patient name and the doctor name, as well as the follow-up date and the follow-up status. So here, this query shows the doctor schedules by the patient name and the appointment date. And we've split up each doctor schedule so it can ensure privacy, since each doctor can only view their own schedule without viewing other doctor schedules. This query also shows all the doctor schedules with the doctor specialty and each doctor's working days. So patients can be able to book their appointments by looking at the working days and the doctor's specialty, which makes it easier for them to book their appointments. Lastly, we have a query that shows the patient's medical history, including each patient ID and their medical notes that they have received in past appointments as part of their medical history.
So as for the user interaction, we have two parts, the forms and the reports. So here are the forms.
Sorry. Okay, firstly, we have the a new appointment form. And it has the attributes of doctor ID, patient ID, and appointment date and appointment status. Then we make sure that this appointment is completed by a new constellation that takes place by adding the patient ID, doctor ID, appointment date, and medical note. Then for the other two forms, we have the doctor's information form by having the doctor's ID, doctor name, and the doctor's specialty, and his phone number, doctor's address and email. And we see the doctor's working times by adding the doctor's ID and the working days and its working hours. Then the lastly two form, we have the patient form, which includes the patient's ID, patient's name, and the date of birth, its gender, and patient address, the patient phone number, and the patient email. And we make sure that we follow up with the patient by having the doctor's ID, patient ID, appointment date, and follow-up date and follow-up status.
So as for the reports, we as a clinic really appreciate keeping track of our performance and making sure we're always efficient. Therefore, we produce monthly reports to check the number of appointments, number of appointments, consultations, and follow-ups that have been booked with us. So here are the three first reports that I just described. So as we can see here, the number of consultations and follow-ups are less than the number of appointments due to two facts, which is that the consultations are completely dependent on the existence of an appointment. Therefore, the consultations could be either equal to the number of appointments or less, which is the case that we have here. And we also have one follow-up. Why these are less than the number of appointments is due to the fact that some of our patients either canceled or didn't show up to their appointments. And here we have a report of the doctor's schedules in order to make sure we remain up to date with our doctors and their working days, because we have some new hires sometimes. So we want to make sure that we're updated on all the available doctors each day, as well as any previously existing doctors who wanted to update their schedules at any time. And that's it. Thank you.